One thing I do know, there'll be a lot of barristers and lawyers who are going to do very well out of this. That's
Yes, that's right.
maybe I should have done law.
George, you could do many things. You're a brilliant man. Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. This is our Hot Topics show and I'm your host, Louise Shaper.
And I'm your other host, George Margellis.
George, you're still in Sydney. I've had to come back to Melbourne, but after Hick, I spent the weekend in Sydney. I had a great time. My butt is still sore because I did the Manly to Spit walk, which is 11 kilometres with lots of hills and elevation. And yeah, I'm still reaping the benefits from that really long walk.
It was great having you in Sydney. We put on some pretty good weather for you while you were here.
I appreciate that.
You didn't join at the City to Surf on the weekend to add a couple of extra kilometres to your tour?
No, the idea of running up some really big hills, especially they call it Heartbreak Hill. Yes, not really in my wheelhouse, that. But a walk along the cliff tops and bushlands of Sydney, I was up for that.
You're always welcome in Sydney. And if you ever want to leave the cold, cantankerous world of Melbourne, there's always room for you up here, Louise.
But it was great to see you at Hick last week.
Yeah, it was good to see you in Hick. I've had 2 pretty full-on weeks since we last had our Hot Topics call. I literally jumped on a plane after our last call, went down to Melbourne for the Ignite the Spark for Aged Care meeting, which was an interesting collection of people from around the sector, and then off to Hong Kong for the Golden Age Foundation. It's a not-for-profit group which basically supports the development of smart aging cities in Asia by catalysing dialogues and supporting real-life demonstrations. That's their motto. They had a big exhibit floor of innovative uses of technology, very much focused at older people to enable them to stay at home longer, to communicate with their families longer, to communicate with other older people more effectively. So I have to give a shout out to the 2 ladies who were my minders, Angela Tell and Phyllis Chan. They looked after me well. So literally I flew in straight from Melbourne, got changed in the bathroom of the buffet restaurant and went on stage 45 minutes later.
Oh my God.
It was, something that you say you're never going to do, but literally I arrived into Hong Kong airport about 7:30 and I was on stage at 10 and Hong Kong airport's an hour out of the city. So it took us,
I'm glad it worked out. I would have been so stressed.
Hong Kong airport was amazing. I was in and out of Hong Kong airport in 15 minutes. So that was great.
Amazing.
And then on the fast train into the city. But Angela and Phyllis managed to get me there and presented it first thing in the morning, went to a luncheon by the Development Bank of Singapore looking at innovation. That was great. But around about 3 o'clock in the afternoon, I did start, I have to admit. So I went back to the room, had a bit of a nap, and then back out for some more schmoozing and cruising in the afternoon.
Yeah.
And literally then flew back from there straight over to Hick. I got back Sunday morning, caught up on my
said hi to Marina.
Family activities. Said hello to the family and the kids and headed off to Hick. This is how many years has Hick been going now? Almost 30?
Yeah, over 30 now.
Yeah. And it's good. It's good to see a couple of people I hadn't seen for a while. I'm really excited to see Mukesh Hakalal, one of the original...
It was great to see him on
gods
stage.
of digital health. Yeah, it was interesting. A couple of people making comments. I just look at Mukesh going, "Hey, Mukesh, didn't we have that discussion back in the 1900s?" And he goes, "Yes." Also good to see my mate Colin Hung from Healthcare IT Today. Came over from Canada.
Yeah.
I did make the mistake of calling him an American. I apologise, Colin.
Sorry, Colin.
And he actually took a whole bunch of videos of Australian local experts. So keep your eyes out on LinkedIn for some of Colin's videos.
Yeah,
I have to admit,
saw
I'm
them.
one of them. And the connected care demonstration, which you ran exquisitely, Louise. It was a really good event. I'm excited that you actually had a cold community aged care recipient as part of the journey, what I aspire to become in the near future. So I think it was really good.
Oh, thank you. Yeah, some work I'm doing with the Department of Health here in Canberra. Yeah, we ran this event inside the HIC conference on the exhibition floor where we take people through 2 different patient journeys to showcase what actually happens to their information. And what is so great about that is the tagline, it's the art of the possible. So we're showing things that happen now and through the Sparked group to actually showcase what they're in the process of building and what haven't started yet, but it's on the roadmap. So you're seeing things that within the next 5 years will be really commonplace throughout healthcare. And we get some great feedback from people going through those journeys. So yeah, hats off to the whole team who pulled that together. And thanks everyone who came to visit us at the conference.
It was really good to see people going through those examples and going, I wish I had that. I wish I could do that now. I think the department's done a pretty good job in understanding what the pain points are. And developing solutions starting from the ground up, infrastructure, standards, all those sort of boring things which we don't get very excited about. But the reality is that demonstration showed how leveraging those sort of key components, you can actually get a much more effective learning healthcare system that has better outcomes and better experiences. Now, translating that into the real world is our next challenge. And kudos to Simon Cleverly and his team. We're all working hard to get that story out there.
Yeah, absolutely. It's a great effort, and we will be bringing the community more of those connected care demonstrator events. So look out for them coming to a conference near you. Well, George, we have a lot to cover today. Shall we get started with our first hot topic?
Let's go.
Okay, let's do that. All right, we are starting today at the sharp edge of what AI can do now. And depending on your perspective, if you're more doomer or zoomer, you'll see this as extraordinary, but also potentially unsettling. So scientists at Stanford and the Arc Institute have used AI to design viruses that don't exist in nature. The model is called EVO, and instead of training it on text, the researchers trained it on genetic sequences from millions of organisms, around 9 trillion nucleotides, so it could learn the grammar of DNA in the same way that a language model learns the grammar of English. So then they narrowed its training down to one very well understood bacteriophage and its close relatives, and then they asked it to write some new versions. EVO did as instructed, and it generated 700,000 candidate genomes. The team decided to synthesize 285 of them. 16 produced viable, replicating viruses. So that's biologically functional viruses that have never existed previously. Now, before any of you start freaking out and starting to lock yourselves in a bunker, these viruses weren't designed to infect humans. They were bacteriophages, which are viruses that infect bacteria, specifically E. coli. And researchers deliberately, thankfully, excluded human, animal, and plant viruses from even the training data. So this is a really genuine scientific milestone. Antibiotic resistance scares the shit out of me, and it's a great looming health threat. So I love the idea of generating a virus specifically designed to attack bacteria infecting a patient. But it's also a massive governance problem that we don't have an answer to yet. George, we haven't really even gotten a hold of what to do about AI-generated information that can cause harm. And here we are with this new problem, potentially, about what happens when AI-generated information can produce physical biology. What do you think?
So the story really did grab my attention. And I have to say, when I first saw it, I was a little concerned. Yeah. I'm a big fan of science fiction movies, and I've seen all the apocalyptic virus movies from Andromeda Strain, which came out in 1971, to the fairly recent 28 Years Later, which is a sequel to 28 Days Later, which paints a frightening picture of what a virus has gone amok can do. And of course, we can all still remember the global pandemic. So Science is a well-respected journal. For those of you who are into reading really dense scientific articles, I can highly commend it. It's 16 pages of lots and lots of science. But it really demonstrates that genomic editing, the stuff that we saw from Jennifer Doudna and the CRISPR world 10, 15 years ago, has really come full circle. We're actually now being able to literally produce, and I use the term life in quotes because there is a debate in the scientific world whether viruses are actually alive or not, because there's all these requirements around whether they are alive. But the reality is they produce what was an organism which can have a significant effect on us. And whilst viruses may not be alive, we saw during COVID that they definitely can have an effect. They focused on bacteriophages. Bacteriophages are a really interesting species, and there's something that's had a lot of renewed interest lately. So many years ago, back before antibiotics, bacteriophages were actually the treatment of choice for infection. They were literally the only tools we had to treat bacterial infections. And, they were pretty hit and miss. You chuck a bunch of bacteriophages, cross your fingers, hope for the best, and hopefully the bacteriophages would kill the bacteria. But then penicillin came along, antibiotics came along, and they fell into disuse because the antibiotics that were available were pretty amazing. Come now, 21st century and the buzz around antibiotic resistance, we're actually starting to see active use of bacteriophages again in antibiotic-resistant diseases. And the places they look for bacteriophages are amazing. Sewer water, swamps, jungle domains.
Oh, sounds a bit medieval.
Yeah, look, it literally is. But the mechanism for killing bacteria is quite amazing. From a therapeutic perspective, as a doctor, I'd say, hey, look, if we can develop custom-made bacteriophages to treat diseases bacterial infections that are rampant, kudos, fantastic. That's a real opportunity. But the same concept can be used to make other viruses, and that's where it starts to get scary. So I do note that within the article themselves, they've got, I'll quote them directly, the capability to generate new phage genomes with AI systems also raises important biosafety, biocontainment, and biosecurity considerations, necessitating discourse on the strengths and limitations of governance, policies, and misuse mitigation strategies. So basically, we need to put some guardrails around this. We need to keep an eye on this because this can go awry. But at the same time, if used properly, can actually make a huge difference. Again, it's a very well-respected research organization. They emphasize the need for safety protocols. They discuss the potential for this research to open up opportunities, not just to understand therapeutics, but the other really interesting area they dig into, which I found fascinating, was how we use this research to better understand evolution. Because basically, we started from a bunch of chemicals floating in a pond and we got to where we are now. Understanding evolution at a molecular level, the mutations that are generated by these new viruses and how they correlate to environmental effects. So it actually gives us an opportunity to understand literally what got us to where we are today, starting off with viruses, and the research will continue on going down the track. So in the right hands, this is groundbreaking innovation. It's potentially life-saving. In the wrong hands, yes, a little concerned. So I think we need to make sure we've put in as many controls as we can, recognizing that the good guys follow the controls, the bad guys ignore them. So we just need to make sure we have some mechanisms in place to manage this. But from a scientific perspective, fascinating.
It is, yes. Yeah, I think the key takeaway for Pulse listeners is, yes, the fascinating world of science and how AI is able to fast track so much of this stuff. But it's just an ongoing theme. We discuss it almost every episode, the need for regulation. And in this instance, I noticed that the NIH policy that restricts high-risk life science work, I don't think it even covers computational generation of virus DNA. And we need to really get our skates on, as Enrico said, and look at regulation moving upstream. So towards the models themselves, the training data, the DNA synthesis, rather than waiting to regulate the eventual biological product as an output. So no doubt we will cover more stories like this, George. Fascinating time to be alive. Are you more of a doomer or a zoomer when it comes to where you think AI is going to be going?
I have to admit, I fluctuate from one side to the other. I guess it depends on what I watch on late night TV the night before. Look, I suspect that the benefits from AI will far outweigh negative consequences. However, the same sort of way that we've seen negative consequences of so many other innovations, we'll have to learn how to deal with them. And the key here, of course, is making sure we have properly funded, well-done research with a focus on improving outcomes as much as possible.
That's right. We've talked about what AI can do at a biological level. Well, South Australia picked a pretty good week to announce a royal commission into AI. So for our next topic, we have a South Australian Premier Peter Malinauskas, has announced a royal commission into artificial intelligence. Not an inquiry, not a task force, a royal commission, which is our most powerful investigative instrument. It starts on the 1st of October. It will report in July next year with 3 commissioners and a price tag well above $3 million. The inquiry will examine AI's impact across education, industry, public services, art and culture, and importantly for the pulse bodies, healthcare. Now, the Premier's framing was blunt. AI gone bad will make social media look like a walk in the park. And he wants the big American AI companies like OpenAI and Anthropic at the table. He also revealed he hadn't even told the Prime Minister before announcing it, which I just think that's interesting given the Prime Minister's announcement only a few weeks ago, which we covered here on the pod. Now, South Australia has form here, so most people would know this in Australia, I expect, but not everyone internationally would. But our South Australian government, this is the government that legislated a social media ban for under 16s before the Commonwealth government followed. So this isn't a state sort of punching above its weight by accident. It's something that the Premier wants to lead on. Now, George, we discuss pretty much in every episode this growing tension between advancements in AI capabilities and its adoption everywhere, but governance machinery being way behind. So what do you think about a Royal Commission? Will that advance discussions towards resolving that tension, or is it a lot of bureaucratic overkill and AI is going to be changed completely by the time the report lands mid next year?
So when you add this AI story to the last story about the synthetic viruses, I think you have the perfect script for the ultimate blockbuster apocalyptic movie.
Oh, okay.
This is the story of, AI meets synthetic biology. Or technically, you may well have the obituary for humankind. So depending on how paranoid you are, how you view it, I keep on coming back to my good old friend Arnold Schwarzenegger in The Terminator. But remember, the whole idea of the Terminator movie was that they developed AI that went rogue. And over the last week, there have been numerous stories on TV about AI going rogue. The one thing I do note is that if you look at the original Terminator movie, the world came to an end in 2029 when the AI took over. We've got 3 years ahead of us to make all this happen. So it's all good. So what do we mean by AI going rogue? In Australia, it hacked into someone's gym account and pushed them up the list.
I mean, story.
How cool was that? I'd love that. Get me a seat at a restaurant that I forgot to book for our anniversary. And if OpenClaw can do that for me, my wife would love it.
Can I just jump in, George, just for people who aren't familiar with that story, because I don't know if it got international traction. I know we have a lot of listeners outside of Australia. A guy harmlessly, so he thought, built an agent to say, hey, it's really hard to get into the classes. Could you go and book me into the gym? And the agent, of course, took it 10 steps too far. And actually, not only did it book him into classes, but allowed him to book into classes months ahead of time. And if the class was already full, bumped other people out of the class so that he could come in, which reminded me of that story about if you give AI the task to build paper clips, it could end in an apocalyptic disaster for humankind.
Oh, yeah. The old thing we get taught a lot about in healthcare is the unintended consequences. And you think it's going to come out the one way, and just a little detour of the system makes something come out totally different. The reporting's been over the top. Generative AI is less than 3 years old, and we're already hearing reports of them having lost control of what their tools are. So that's a little bit scary. So I think we need to set a level here and say there's a responsibility when you're developing these tools. We remember a couple of months ago, Anthropic pulled Mythos off the market because it could reveal security hacks. The fact is, in this case, it actually utilized those security hacks. Now, is South Australia and a Royal Commission the right way to go? Well, kudos to South Australia for having the guts to call it out. Like you said, they have been one of our more progressive states. But whether something that comes out of South Australia will have any effect at all on the boys over in Silicon Valley, that's a whole new question. But maybe in the near future, we'll be looking back on this day and saying Peter Malinauskas is the new Sarah O'Connor. And those of you who haven't seen the movie, Sarah O'Connor is the heroine. So maybe the fact that he's forced AI companies to open their kimonos and have this discussion. And to be honest, I've sat in front of a Royal Commission. I was involved in the Aged Care Royal Commission. Enough lawyers in a room will scare you to say lots of things, so maybe they will have an effect. Again, 2 weeks ago, we had this discussion with Enrico. Governance is critical about managing AI going forward, and we need to do it now. His report basically was titled Run, Don't Walk, and that's what we need to do. We need to jump on this bandwagon early. Could well just be a huge media blow up, or it could be the beginning of something much more sinister or something we need to take greater precautions around, because the speed at which AI is advancing is something we're not used to. We thought the rise of the internet was amazing, but it took 10, 12 years before we started getting a mass effect there. We're talking weeks or days often in case new tools come out and there's 1 billion people using them within a week or two. That's just astronomical when you look at the take-up.
It's unprecedented.
And the reality is, we can't ban it. It's there. The ship has sailed, the horse is bolted, use whatever analogy you want. The big AI companies are doubling down. I think the most we can do when it comes to healthcare, we need to focus on outcomes, focus on making sure we're using it for beneficial purposes and publicly disclosing when it's not, when things go wrong, when things go bad, so that we know there are challenges rather than sweeping them under the table and hoping for the best.
Yeah. Well, hopefully there will be a public call for submissions, that type of stuff. When that comes to light, we will promote it through the pod. We'd certainly want to see in terms of reference things like clinical governance, clinical safety, AI in public hospital procurement, and well, across any aspects of procurement that I think government control, workforce displacement, and of course, where liability sits when a clinical AI gets something wrong. These topics we discuss all the time. Yeah, we'll keep an eye on this story, but good on South Australia for, I think, having a go. And I do want to say as well, the Premier was very clear in his announcement. He's not anti-tech at all. If anything, he wants South Australia to take a leadership role in this, but it shouldn't just be the Wild West. Let's take a quick break. And when we come back, we're going to be talking about something George and I have been wanting to talk to you guys for a long time. So we're going to have that conversation about how do we continuously monitor humans and the data we collect. So more on that topic soon. All right, welcome back, everybody. Now, what happens when something we've only ever been able to measure occasionally, if at all, becomes continuously observable? Well, continuous glucose monitoring changed diabetes care completely. It turned a single number taken once into a live data stream. And once you have that data stream, you can see patterns, predict events, personalised treatment. Everything changed for diabetes care. Well, hormones have no equivalent. And as friend of the pod, Ida Tin stated, hormones have stayed in a black box. We simply just don't have the technology to turn those hormone molecules into a data stream. And Ida is blunt about the consequence. Modern medicine was built on the image of a male body with a steady hormonal backdrop. So variability gets treated as a complication rather than the core data source it is. Now, we're not speculating about whether that dynamism matters, because a few episodes ago we covered that extraordinary Nature Medicine study where there was 198 plasma proteins, which vary significantly with what day of your cycle a woman is on. So immune, inflammatory, hormonal, tissue remodeling, a woman's biology is measured in a different state week to week, if we had the data to be able to do that. So that study in Nature Medicine needed a blood draw and 75 protein panel to see that. What an organisation called Sprind out of Germany is now asking for is that same signal continuously from sweat or interstitial fluid while you go about your day. So Germany's Sprind, their federal agency for breakthrough innovation, has now put 40 million euros behind fixing that. So they've got 8 teams who have been chosen from 68 applicants across the globe, and their brief is pretty simple. Continuously measure at least 4 hormones directly for 7 days straight. So, George, we're definitely going to be reporting back on this one because we have so much that this could cover. We've got fertility, IVF, menopause, perimenopause, women's health research, over-measurement, consumerization, so many topics that every woman, I would expect, and everyone who knows a woman is going to be maybe impacted by the eventual results of this challenge. And good on Germany for backing it. What are your thoughts, George?
Point out that men also have hormones. We don't have as many as women. I mean, we're not quite as complicated.
Oh, yes, of course.
But we do have hormones. This story got me really excited. So I first studied human physiology in 1980, a subject called Human Physiology 1A at the University of New South Wales. And even back then, I was amazed by hormones. Hormones are an amazing thing. They're a simple collection of amino acids that are produced by cells within our body and can control the actions of billions, if not trillions of human cells in amounts that are measured literally in micrograms. I did a bit of research, Louise, because I thought, many people may not understand what hormones do. The total volume of all hormones circulating in an average human's blood at any given time is less than 2 milligrams. So we're talking minuscule amounts of a chemical floating around in 5, 6, 7 litres of blood that we have in our system. And if you look at that, half of that hormone collection is cortisol, which is produced by the adrenal glands and has very specific functions. So in actual fact, if you look at some of the other hormones, and there are literally dozens of hormones and they have really amazing effects, their measurements are taken in nanograms. So we're talking minuscule amounts of this teeny weeny little protein. Actually, most of them are too small to even be called proteins. They're called peptides. And yet they are one of the 2 main control mechanisms in the human body, the other one being the nervous system.
Yep.
The first hormone insulin was discovered in 1921, and it was first used therapeutically in 1922. And it actually made an amazing difference. Before 1922, people with type 1 diabetes basically died very young under very difficult circumstances. Their body literally ate itself to produce fine sugar. Simple injection of insulin. And now we have people being treated for diabetes type 1 from birth up until their 60s, 70s and 80s. So it's amazing how we've actually been able to take the science of hormones and use it therapeutically. And then when we start looking at what it controls our growth, it controls our kidney function, it controls muscles. It has an amazing amount of things that it controls. And when you look at the reproductive system, it basically controls how we take two cells from two single human beings and turn them into a human being. So it's amazing. Now, Ida Tin, who we spoke a while ago, she's done some amazing work. The reality is the reproductive hormones play a particularly important role, not just in our reproductive cycle, but in the overall physiology of women in particular, because they affect more than just the end organ. They don't just affect your uterus, they affect everything else. And whilst we've been talking about continuous hormone monitoring for a long time, the reality is it's hard. How do you detect nanograms of stuff that's in your blood without taking 50 to 100 mils of blood out of a vein and sticking it through a mass spectrometer and doing a whole bunch of tests? This is something we haven't been able to do. I mean, even when you look at diabetes, at this stage, we still don't do continuous monitoring of the insulin. We do continuous monitoring of the effect of the insulin, which is the blood glucose. So we have a surrogate measure for insulin levels using blood sugar. So the complexity of what they're looking at can't be underestimated, but the effect, the potential benefit of being able to do it is enormous. I think we've got really a really great opportunity here.
Yeah, and I noticed, George, the 8 teams, they're using different technical approaches and they're funding them all at the same time. So there's patches, wearables, implants, optical sensing, sweat-based platforms, and the enzymatic systems, which are modelled on the glucose monitors as well.
I have to take my hat off. I hadn't heard of Sprint before, so I looked them up and they sound like a fascinating organisation. That they're a national agency for the German government, but unlike the traditional NHMRC or NIH or even our CSIRO, they don't double down on a single idea and run with it. They basically drive innovation, and their mantra is they're designed to fund and accelerate high-risk breakthrough innovations that can transform entire market, technologies or societal systems. And they don't just do healthcare, they do a bit of everything. We're working on this to develop a way of monitoring 4 key hormones over 7 days. That's fantastic. We need to start looking at clinical models that utilize this data to provide health outcomes. What we need to also understand is how the hormone has an effect, because there is quite a complex science. So you can release hormones, but then cells have to make themselves receptive to hormones. So there is a whole receptor science around how cells receive the issues from hormones. And I think this is where there's going to be a lot of work needs to be done. But we do have an opportunity here to do a huge leap forward, to shift the paradigm. At the moment, we tend to do things like provide drugs to counteract a hormone or to replace a hormone. One thing I would do at this stage is, if anyone out there is currently studying medicine and is considering a career, I think endocrinology is about to have a massive change in the way it works. At the moment, they've got limited drugs and limited applications of what they can do. If this technology takes off and we can have systems where we can track hormones in real time, understand their effect more efficiently, deliver solutions that can manage the hormone imbalances in real time, not only do we have amazing new opportunities for infertility and reproduction and in things like perimenopause and andropause and all those sort of things, but we also have an opportunity to fine-tune people's health experiences by managing these hormones. Interesting times.
So good. I really want to see how these guys go. We will report back and maybe we can get Ida back on the show. For those of you who are new to the show, go back to our first few months of recording back in 2024. So do a reverse lookup and you'll find our interview with Ida Tin, who of course coined the term femtech. So she's been behind this and I'm really looking forward to seeing where this goes. So we will be reporting on this soon. So, George, finally, for our last topic here, but on the same idea of measuring humans in a continuous way, we just discussed turning hormones into longitudinal data. So I want to ask a question. What happens when we do that with the rest of the human body? Well, Google told us in this last week that they are attempting to do for the body what large language models did for text. Google Research has released SensorFM, our foundation model for wearable health data, and the scale is pretty much the headline. It is huge. It was pre-trained on more than 1 trillion minutes of sensor data from 5 million people who gave their consent across more than 100 countries and 20 plus Fitbit and Pixel watch models. That's over 2 billion hours of minute-by-minute physiology. They say it's the largest and most diverse wearable data set ever used to train a model, which sounds very believable. And here's why it matters. So until now, wearable health models have been looking looking at one outcome at a time. So a bespoke model for atrial fibrillation or another for sleep apnea. Well, SensorFM learns one general representation of human physiology and then transfers it across 35 different health prediction tasks, which can span cardiovascular, metabolic, sleep, and mental health. And what really caught my attention here is what Google thinks we might eventually be able to do with all of this data, which is to use SensorFM to ground a personal health agent. So instead of your watch giving you yet another dashboard full of numbers, an AI could potentially develop a longitudinal understanding of me, of your physiology, and help interpret what those signals mean for you. Now, George, I think this is a key step towards building the foundation model for a digital version of ourselves. What are your thoughts?
So Google is back. It's weird that a company that's 27 years old is often perceived as the dinosaur in the AI world. But the reality is Google's been around from the beginning of the internet almost, and it continues to surprise us with new innovations. And in particular in the healthcare world, where we've recently had discussions about DeepMind, and admittedly the growth of Google has been by acquisition, but they've really managed to get into some of the research components in a big way. So I take my hat off to them. I guess it doesn't hurt that when you've got a market cap of $5 trillion and you make $400 billion a year. And they obviously have access to a lot of data. This new foundation model, 5 million participants, 1 trillion minutes of wearable data. They claim that it's a universal representation of sensed human physiology. Sounds really impressive. But the reality is that it really is just a collection of data that they're trying to work out what to correlate it with. And it's that constant old saying of correlation does not equal causation. So we don't understand, first of all, what data we have. We try to correlate it to what's happening in the real world, but the quality of the data has to be questioned in this case. Smartwatches have been evolving, but we all know that they really aren't 100% accurate in capturing data, and we can't compare the data we capture with highly tuned medical devices with what someone's Pixel watch is telling them. So there is the question of quality of data. And then there's also the question of what they're correlating it with. And this is an interesting topic of discussion because much of the data they're correlating it with is basically user-entered data captured on a bunch of forms. After they've measured someone for a couple of weeks, they'll ask them, on Wednesday, how did you feel? And how did this correlate to your health condition? Trying to link all that sort of stuff up is hard.
Yeah. And George, if a model learns my normal baseline, then I would have thought that a deviation from my normal could ultimately become more useful than a deviation from me against a population reference range, particularly for groups where there isn't a lot of data that is available for research purposes because of a certain condition you might have that's rare or you're in a minority population. So I think this could be really interesting from that population health perspective too.
Humans have a huge variety of responses to various issues. So if your pulse has gone up, what does that mean? What do I correlate that to? It's very easy to correlate it to disease, but it could be that you just happen to be climbing an extra set of stairs because the lift was out that week. The metrics that a smartwatch can capture at the moment are useful for feedback mechanisms, being able to use it for people to understand their own physiology. So I think you make a very valid point that using these sort of numbers to understand your own physiological responses and correlating them directly individually. The other thing, of course, with this sample size, people who have a Pixel watch aren't necessarily representative of the population.
Yes.
I mean, you have an Apple Watch, so you're not represented in this group.
I wondered what happened to those decades of Fitbit data, though, that Google now have. Yeah. I don't remember seeing a form, but I wonder if they used any of that.
And it's interesting because, if you look back at the early Fitbit data, it literally only started off with steps and worked its ways up into physiological parameter measurements. And there's still a lot of conjecture in the accuracy of the data that we get from these watches. So taking a whole bunch of data from the wild and trying to correlate that to clinical effect is challenging. Maybe DeepMind can solve the problem. Hey, if you can beat people in chess and Go, maybe you could solve this problem as well. But having seen a number of people claim to be able to do this and then seeing it fail miserably, remember the glucose monitoring contact lens that was going to save the world?
They were going to be great.
Yeah.
Didn't quite work.
Yeah, except for the fact that they didn't work and basically caused significant eye irritations. That's a whole different kettle of fish. I think it's early days. Watch with interest, but maybe I'm just getting old and cynical, but I'll wait till we get past the original first paper and wait to see the real evidence. How is our friend from Theranos going? She's still in jail? I'm not quite sure. Yeah.
Oh, yes, yes. I believe she is. Okay. All right. George, I love the skepticism that you bring to our discussions here on the pod. You're usually more skeptical correctly than I am, and you have a wealth of knowledge in your head and have been around for a long time to be able to see these grand claims that sometimes don't lead to anywhere. But yes, we will continue to bring stories like this onto the pod to hopefully inform our listeners and get you guys thinking about things differently. So, George, today we've looked at AI capability and governance with AI designed viruses as just one of the latest AI developments in healthcare, how an Australian government is prioritising how we govern where all this is going. And we also looked at the continuous human with various initiatives on how the data that we're currently collecting and use across healthcare is really just scratching the surface of the data that can, and I think will be used eventually to transform healthcare from episodic care models to continuous health intelligence. I only hope I'm alive to bear witness to that and also to reap some of the benefits from it. Do you think you'll be around, George, where we will see these new models of care and new modalities of care change as a result of all of this technology and data that we have available to us now?
So whilst I may appear very cynical, I do keep across all the longevity research looking for that secret source if it's going to make me live to 150. So hopefully I will be around. Look, I really enjoyed this week. We looked into some real science. We looked into genomics. We looked into synthetic biology. We looked into basic human physiology 101, our hormones and how they work. And the key now, of course, is how we take that basic science, tie it up with the AI, and that provides us an opportunity to provide new solutions. So I think what's happening is that we have an opportunity now for basic science research to be facilitated by AI, which will provide us with new ideas that hopefully will keep you and I alive longer. We've been pretty good at keeping people alive longer, but as we've discussed many times, we haven't been very good at keeping them alive well. So the combination, I think, is really cool. So keep on listening to the podcast for innovative stuff happening, but keep that little bit of a cynical eye around the hype. We are in an interesting phase of life in this space.
Oh, I agree completely. George, do you have any recommendations for the Pulse Potties this week?
I came across a pretty cool tool called Paper Guide. It's a research platform which makes it easy to find scientific articles. But rather than having to find each article, then stick it into a chatbot and ask it to analyze it, compare it, you can actually use this tool to generate almost in real time a literature review on a whole bunch of papers and compare them to each other. It's one of the few tools that after a couple of uses, I actually went and paid a subscription fee for because I thought it was worthwhile. So for those of you who are sort of into the scientific research world, have a look at Paper Guide. It's a pretty nifty tool.
Oh, thanks, George. I'll put a link to it in the show notes. I found two things. One is a repeat. So just reminding everyone that if you're a clinician and you're interested in topics around AI, there is some research that Monash University are doing here in Australia. They want to hear from clinicians all across the globe. So have a look at that quick survey, which I will put a link to the show notes. And then a new research study, which is again an international study. There's an independent team which is doing a survey to understand the gap between AI policy and the reality on the ground in healthcare. We cover that a lot on the pod. We know that there is a massive gap. So they're trying to not just understand what that gap is, but actually look at the realities of that through the lens of frontline clinicians. So if you are a frontline health worker anywhere in the world, have a look at the show notes for the link to that survey. Really encourage you to do it. The deadline is the 2nd of September, and that was sent to us from Alice Liu, who I first met when I was doing some work with the World Health Organization. And Alice is based out of the US. Hi, Alice. Thanks for sending that. And hopefully our shout out can get that onto many clinicians' agendas to contribute to that research.
One other thing I'd like to note, I got an email from our good friend Jeanette Hughes over in Scotland, who's coming out to Australia in October.
She is, yes.
She'll be here for a couple of weeks. She's an amazing person. And what's happening in Scotland is actually quite amazing. Whilst they seem to be tucked away in the corner there of the United Kingdom, they've done some amazing research. One of the very first projects I was involved with when I was at Intel was a pilot around remote patient monitoring in Scotland. I don't know if I told you the story, Louise, but we had to put subtitles on the video because the Americans couldn't understand what the Scottish team was saying. So, yeah, shout out. Hopefully we'll get Jeanette to do a live interview while she's over here.
Yeah, we
but
should.
I'm sure you and I will be catching up with her a few times. And opportunity for other people who want to hear about Scotland, keep your eyes open for Jeanette Hughes' visit.
Yeah, thanks, George. And yes, Jeanette's been in touch and friend of the pod. We've had her on the show before. So So it'd be good to get her back on as well and get an update from what's happening in Scotland. All right, George, always a pleasure. As always, can't get through all the content that we talked about that we would discuss, but hopefully our listeners have found this a valuable episode. So thanks everyone for listening. George, if you could please read us out.
Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Emily Mara and her team at Pulse for their support. Big thanks to everyone for listening. Make sure you subscribe, follow and rate us wherever you get your podcasts. And if you feel like sharing it with your friends, feel free to. Visit pulseit.news to catch up on the news from Australia, New Zealand and Ireland, and send any feedback on the topic or topic suggestions to pulsepod@pulseit.news. We'd love to hear what's on your mind.
Thanks, George.